The teenage brain, understanding how it works and impact on their mental health. Let's shift gears for a little bit and touch on the human mind. We discussed how our brains are constantly scanning our environment and trying to make meaning of incoming data. When our mind takes in information, it does it in a way that allows us to understand what is going on. It wants to make sense of this data, have it balance out, and that will help us determine what actions, if any, that we'll need to take. Incoming information is processed and interpreted based on our minds wanting to have it balanced and predictable. Data is also perceived based on our history and previous interactions and experiences. We use that information to gain an understanding and ability to predict situations that unfold. To illustrate this point, let's look at the next few slides as an example. We read or interpret these symbols based on our previous experiences and interpretations, which include our history and life interactions in the context which we take in information. The symbol that we are showing right now was a consistent symbol in the two previous slides. If you look at it, most people would read it as a letter B in the first series of slides. In the second series of slides, it would come out as the number 13. The same symbol was in both slides, but most of us would interpret it as a B in the letter slide and a 13 in the number slide because of the context of which it was presented. This is just one of many different examples of how our mind looks for predictability and for logic and, more importantly, for balance. Another complication is how some mental health issues present themselves. Symptoms of problems in a lot of mental health diagnoses begin to become evident in teen years. If we are taking into consideration brain development challenges at this age, this could be a huge problem for teens, as well as family trying to separate adolescent developmental behavior from mental health issues. Now that we looked at all the hurdles that adolescents face at this time, and especially if we're talking about one struggling with a mental health issue, we can take a deep breath and now figure out what parents and adults can do to help navigate teens through adolescence. A starting point for parents is patience and understanding. We also want to rule out any mental health issues from adolescent developmental tasks or challenges. This may require the assistance of a professional. Educate the youth on what they are facing and letting them know to some degree this is all normal. We really need to understand and recognize the different perspectives between adolescents and adults. If we expect adolescents to have the same internal motivation and decision-making as an adult, we are really setting ourselves and the youth up for disappointment. Teens are looking through life from a different lens, and motivation and perspective is going to be different than an adult. Adults can help youth work through, not avoid, but work through stress and stressful situations. This allows teens to build up resistance and also allow them to manage stress, which no one can avoid in life. The more they practice, the more they learn. This creates neural pathways in our brains. And the more these pathways are used, the easier they are to access. Here are other considerations to keep in mind for adults and/or parents in helping teens journey through adolescence. Parents shouldn't look at themselves as bystanders in their teen's journey, but more as helpful guides. There are many studies that support the importance of parent involvement in teen years. Although teen years can be faced with challenges, it can and often is filled with wonderful experiences. However, for some, it could be a trying time. Helping your child get through the turbulence will be building a teen who is more successful and better equipped for adulthood.